Coming to the body changes or the pathological outlines, what is happening inside the body that is causing this endometrial thickness to increase, and what is the normal endometrial thickness and what is the pathological endometrial thickness? Let's dive into the body changes to know more about it. As you can see, this is the uterus or the female reproductive organ. These are both the ovaries, these are the fallopian tubes, and this is the uterine part. So today we will be discussing in depth. So as I told you, fibroids can cause endometrial hyperplasia. Fibroids are growths inside. It can be subserosal in the outer lining, or it can be intramural inside the muscular layer, or it can be submucosal, which is growing inside the uterine cavity. So these fibroids have a tendency to increase the blood supply to the uterus. Whenever there is increase in blood supply to a certain part, obviously it will grow. So the endometrial thickness will be enlarged in fibroids. So what is the presentation? If you are suffering from bulky uterus and you don't know what are the major causes, or if you are feeling a sensation of heaviness in your lower abdomen and you have not got your USG, you can analyze through these symptoms. If there are fibroids associated with bulky uterus, what will happen is you will have prolonged bleeding, you will have pain during intercourse, and also you will have this bearing down or sensation where there is something heavy in your lower abdomen. These are the symptoms which present along with fibroid. Now coming to the adenomyosis part. This endometrial layer, if it goes inside and grows in the muscular layer, then that is called as adenomyosis. So in adenomyosis, what are the conditions? You will have severe pain along with heavy bleeding. This is adenomyosis. Next, coming to ovarian cysts, which are cysts formed in and around the ovary, or PCOS. These are also small multiple cysts. So what happens in PCOS and in ovarian cysts is that they will have severe dysmenorrhea or painful menstruation, but along with that, they will have irregular menstruation. Sometimes it can be very little, sometimes it can be too much, sometimes there is no menstruation for 3 to 4 months, sometimes there is prolonged bleeding for more than 1 month. All of these disruptions are caused by ovarian cysts. And in PCOS, this irregularities along with excess androgenism, that is hair near your chin area, your chest or the back, along with polycystic ovaries and irregular menstruation can also be the cause for endometrial thickness. The next one is endometrial cancer. In endometrial cancer, you will find that it is not regular. The bleeding is abrupt, especially vaginal bleeding, which is abrupt, which is mostly found in menopausal women. If there is bleeding after the menopause has been attained, you have to get a checkup with the gynaec. Next, coming into the perimenopausal state. In the perimenopausal state, the hormonal fluctuations are too much. That is, there is excess and lowing of certain hormones which will cause endometrial hyperplasia. As we have already discussed the causes, now let's see, because in all of this there is one problem, that is increased estrogen level. This increased estrogen level will have an effect on the endometrium which will cause it to expand. Okay. So estrogen will help in expansion or proliferation or increase in thickness of the endometrium, and the progesterone will maintain that thickness. So what is happening in all of these diseases is that there is increased estrogen or hormonal fluctuations which are leading to thickness in the endometrial layer. So what is the normal endometrial layer thickness? Remember that the endometrial thickness will tell you if you have bulky uterus or not. During menstruation, if you get a USG done, the endometrial thickness should be 1 to 2 mm. If it is during the follicular phase you are getting your USG done, then the thickness should be around 5 to 7 mm. And then if you are getting it in the luteal phase, that means after the ovulation has been done, that is called the luteal phase. If you are getting it done then the endometrial thickness should go up till 16 mm. Having more endometrial thickness, that is more than 16 mm, or in the menopause era, if you are having endometrial thickness of more than 5 mm, it is suggestive of bulky uterus. Coming to the consultation part here at Fidicus. If you are suffering from bulky uterus, or if you are suffering from any female reproductive problems and you want a proper cure, here at Fidicus we are offering you with 2 different types of consultations. The first one is online consultation. If you're not near our nearest branches, you can consult us online through two options. One is the audio consultation, second is the video consultation. And you can share whatever investigations that you have with us, and if we need anything more, we will suggest you. After doctor consultation, you need not worry about the medication. Your medication will be delivered to your home within 3 to 5 days if you're staying in India, 3 to 6 days if you're staying in USA, and 4 to 8 days if you're staying anywhere else. If you're staying near the nearest branch of Fidicus, then you can come and consult us in person. If you're suffering from any of the female reproductive organ diseases and you would like to get in touch with us, you can consult us through this number. You can call us, WhatsApp us, or message us through this number. If you're suffering from bulky uterus or any of the female reproductive organ issues and you're looking for a proper cure, why should you choose Fidicus Homeopathy? Here at Fidicus, it stands for highest chance of health, and we are having three principles that we follow. Remember that we have already had bulky uterus cases with high success rate, and also the treatment we give here is proper, and there is no gray area between the patient and the doctor. It is always black and white. That is we stick to the rules, and also we will explain it to you if you have any sort of doubts. The personal care that we give here, if you're having any sort of doubts, you can discuss it with us, and we are here to help you. The personal care at Fidicus is top notch. If you want to choose homeopathy, if you're looking for a proper treatment, and if you're looking for cure, choose Fidicus Homeopathy. Thank you.